Hello, welcome to the Thai Press, and I am Nahoho Rashid Matselele, your host, and we are going to be looking at health issues. Today in this program, we are going to be focusing on the aspect of accidents and first aid. Nowadays, the most prevalent cause of deaths among Ugandans is accidents. And among accidents, we have road accidents and other types of accidents that we cannot mention here. But the most important thing is that when somebody has got an accident, what should be done? And that is what we call the first aid. The first things that should be done before that person is taken either to an emergency center, to the hospital. We want to know what should be done, and we are going to be mainly looking at the issue of bleeding. What should somebody do when a person has got an accident? You people who are around there, what should you do? How should you react, especially when somebody is bleeding? To take us through this discussion, I have a medical practitioner. I always want to call him doctor, but I'm told that he is not a doctor. So I think I will ask him to introduce himself in the way that he wants people or the public to know him. Yes, please. You can.
Thank you so much. My name is Mukwanga Abdul Hakim. I'm a medical laboratory scientific officer by profession, and that is I'm specialized in laboratory work, medical laboratory work. We look at hematology, chemistry, clinical chemistry, microbiology, all that.
Okay.
But in this topic of today, I have an insight about the topic because we are taken through first aid as an emergency response as medical laboratory practitioners. So I'll be elaborating on a few aspects in what someone is supposed to do during bleeding or first aid for a person who is having probably a deep cut or a simple cut when they are bleeding.
Thank you very much, Dr. Hakim Mukwanga, laboratory scientist, and he's going to be taking us in what he has just mentioned. I want to put forward a disclaimer that this being a healthy discussion, whatever you're going to hear in this program is not the final prescription. We are not here to prescribe any treatment, but we are here to just take you through what should be done when somebody has got an accident, when somebody is bleeding. Now, doctor, I want us to start on the issue of stopping bleeding when somebody has got an accident and maybe somebody is bleeding. What do you want people to first have in their mind?
Thank you so much. Thank you, all dear viewers, and thank you for giving us this opportunity. As you said, that bleeding is one of the leading cause of deaths in accident victims.
Yes.
Because in most cases, people don't die from the initial accident that happens.
Definitely.
But because of the bleeding that happens after the accident, people lose a lot of blood. And we know blood is the essential part of the body that, transports oxygen and everything. So when they lose that oxygen, in most cases, they die before they are taken to the hospitals. So those 5, 10, 15 minutes are so crucial when an accident has just happened because it can save someone's life. But if the people who are around don't know what to do, then automatically they are going to waste that time before the emergency services come in.
Especially nowadays, I always see a scenario that when somebody gets an accident, let's say road accident, you will find that people are just looking on and getting their mobile phones, taking
trying to update
videos
others on social media and everything,
instead of saving
when actually
life.
they could have actually saved life. Because not all people that are involved in an accident actually die of the accident, the initial accident. But because there are those life-saving skills that are lacking in our people, that's why we see it fit probably to sensitize the public about these things. So in bleeding, in most cases, bleeding, as you said, road accidents have a lot of bleeding because it's a sudden concussion that happens to you, and sometimes you have an invasive object that cuts your body, or maybe the limbs, or the abdomen, or the chest, and it can cause bleeding. So I'm going to give you 3 types of bleeding. We have number 1, the arterial bleeding. Arterial bleeding is whereby the arteries are the ones that are affected. How do you recognize an arterial bleeding? When you see blood that is gushing out, sometimes it gushes out.
Yes.
In a fountain kind of.
Yes, yes.
Some other times, blood keeps coming with the successive heartbeats. Whenever a heartbeat happens, blood gushes out. Whenever a heartbeat happens, blood gushes out. So that one is an arterial bleeding. And arterial bleedings are the most severe of them all, because number 1, they're affecting arteries. Arteries are the blood vessels that move blood from the heart to the body.
Yes.
So instead of that blood going to benefit the body somewhere, it is actually coming out. Number 2, they are big vessels, the arteries. They have huge walls, and therefore blood moves at a very fast rate. They're not like veins, where the walls are a little bit light and blood moves at a slow pace.
Okay.
Because veins basically move blood from wherever the extremities are, or whatever body part, back to the heart. So in arterial bleeding, that is what is happening. And that is how you can identify that this is an arterial bleeding.
When the blood is gushing forth.
Gushing out, or with successive heartbeats, you see, it's like a rhythmic part of it. You see blood coming out, then stops a little bit, comes out. So it's like a heartbeat that is happening. So
there is a sign that an artery has been affected.
Exactly. So those are the signs that an artery has been affected, and that is an arterial bleeding. Then we have the venous bleeding, whereby the accident has affected a particular vein, and with that you will see blood oozing out on a steady pace, because as blood is coming back from the body to the heart, it comes at a steady pace. So there you will see blood coming out at a steady pace. It's not so gushing, but it's just oozing, and not at a very fast rate. So that one is a little bit easier to handle than the arterial blood.
The other one.
Then we have the capillary the capillary bleeding, whereby it is superficial, because capillaries are the most superficial blood vessels that you can see. It can happen when probably you prick yourself, or you step on maybe something sharp, and it doesn't penetrate deep, but just superficially. So that blood that comes out, when we prick you, when you come to the hospital with the laboratory people,
Yes.
when we prick you, that is capillary bleeding. When you're taking off samples for malaria, or maybe just a blood smear, that one is just a capillary bleeding. So that one is very, very small, and within a few minutes, it will stop coming out. But with the arterial arterial bleeding, it doesn't stop that quickly, or it doesn't stop that easily. So for that one, it requires emergency first aid. So this is what people need to know. Or when you find an accident victim, first of all, you're going to first check out for any injuries that has happened to the person.
Yes.
Sometimes you might be also a victim of accident, but when you check yourself, you don't have any serious injuries. Then you check on the others who are inside there, and then you see which kind of bleeding are they having, and then there we shall see what to do.
So these ones, which you've talked about, the 3 types of bleeding, that is the arterial, venous,
and the capillary.
Yes. Okay, these are the ones that we can see. But there are sometimes when you see somebody is okay, he has not got any injury, blood is not flowing, but maybe internally there must be an internal bleeding that somebody has not. What do you say about that?
Exactly. So with given the fact that here we are dealing with mainly first aid, and of course first aid is not a response that is, and what you should know, we have 2 types of first aid. We have the emergency first aid, which is a response that is given by any person, not necessarily a trained person in first aid, but someone who sees an accident has happened and they want to save a life. So they may not necessarily be having the technical know-how, but they want to save this person's life. Because they normally give what we call emergency first aid. They want to save life to prevent any further complications to the accident. And then we have the standard first aid, whereby now this one looks at examining the injuries, trying to see if the person needs resuscitation. But if you don't know what to do, stay put.
Okay.
Call the emergency medical services or call 911 or 112 for the ambulance to come in so that they can handle the standard first aid on site before they can take the person.
Okay. Yes. Thank you very much. Now, what ways can one stop bleeding when now somebody has got an accident, and now what should I do to see that that bleeding stops? Exactly.
So we have around 3 ways of stopping bleeding. In most cases, in terms of arterial or venous bleeding. Number 1, we have what we call applying a tourniquet. A tourniquet is a band, kind of a band. When you visit the hospitals, you know, we deal with tourniquets as medical laboratory technologists. When you come to the hospital and we want to take off venous blood, we shall tie some kind of band on your arm.
So for us, it's somehow like a rubber band.
Exactly.
Yes.
Some people use gloves. Some others use the commercial tourniquets. So with the tourniquet, when they tie it, they will pull it to the extent that you know, we want to see the veins. We want to make the veins visible so that we can take off blood from the appropriate site. So that's why we apply a tourniquet. What the tourniquet does is it prevents the flow of blood. When we tie it here and we want to get off blood from here, it will prevent the flow of this venous blood back to the heart. Then blood is going to accumulate below that tourniquet, and therefore it will become more visible.
Okay.
Yes? So this is the essence. So even when we are treating someone who is bleeding, for example, an arterial bleeding, our dear viewers will see the demonstration that we are showing to them on your screens. There are those commercial tourniquets that are readily available. If you don't have it, you can probably use a piece of cloth. If clean, well and good. If not clean, still you can use it, because we are looking at saving a life. So you apply it above the area where the cut has occurred. You know, this is the first step, or this is the first method of stopping bleeding. You apply a tourniquet. Ideally, it wouldn't be the very, very first one, but for emergency services, you can use it, whereby you apply above the area where the cut is. And when you're applying it, you make sure you tighten it as much as possible. Of course, you have to tell your patient, if at all they are conscious, you have to tell them that it's going to be a little bit painful. They should expect some pain. And if they are non-conscious, then that is well and good. But at least if they are having a pulse, sometimes you have to check for the pulse and also breathing. You check for breathing to know that whoever I'm attending to is still alive. Yeah, because we want to save a life. You don't want to work on someone who's already dead. Yeah. So you apply the tourniquet. You can use a finger, about 2 fingers or 1 finger, above where the area of cut is, and you make it as tight as possible so as to prevent blood from flowing from the heart.
That's why you tie
down.
Above.
Exactly. So you tie the side of the heart, you know, the heart is in the chest, so you don't tie below, below the wound, because you're now preventing nothing, but you have to tie above from the side of the heart. Yeah.
Okay.
So when you tie it very tightly so that you prevent blood from crossing. And how do you know that you've tightened it very well? You have to see that blood stops gushing out.
Okay.
That's how you know that it has stopped flowing, that blood has stopped flowing. Before it stops flowing, you still tighten as much as possible.
Okay.
And you know, there is a dilemma with the tourniquet, in that when you're applying the tourniquet, you're supposed to know what time you've applied it. Why? When you leave it for so long, past probably 4 or 5 hours, it becomes, you know, blood is not moving to that particular part of the body, and therefore the cells are going to die off.
Okay.
So you don't want that to happen. Actually, when the medical services come in, the emergency medical services come in, you have to tell them when you tied that tourniquet, because they have to determine whether to let it to let it go, or to transport the person if the time is still there and is enough, because we don't want to lose the limb now or the extremity because of the tourniquet. But I've told you, you don't necessarily need to use the emergency, the commercial tourniquet. You know,
can I use even my cloth?
Exactly.
My
you
shirt?
you can use a shirt. You can use a trouser. You can use any cloth that you find. But as you can see in the video about the technique, you're supposed to tie it. Sometimes you tie the first one, roll it over about 2 times, and then if you're not using the commercial tourniquet, you tie another cloth so that you can keep whatever you're using to tie in place to prevent it from moving out again. And then the other second way of stopping bleeding is using gauze. Again, in emergency situations, you may not necessarily have gauze because you've had an accident probably in the middle of a forest and you don't have any gauze around. You can still use a cloth, any cloth that you can get, your shirt, your trouser or anything, and what you're going to do is to keep pressure on the injured area. Either you can use a gauze if you have one, bandage, or you can use a cloth that you can get your hands on and press as much as possible on the wound. In most cases, look out for the source of the bleeding. If it's an artery, it's a little bit inside, probably it has there's ulceration on the skin, the muscle has been already ulcerated and it's exposing the artery. So look for the origin of the bleeding, and that's where you press. In most cases, you press the artery against the bone, so that you stop that bleeding. So when you stuff this cloth or gauze in that wound, you're trying as much as possible to press against that source of the bleeding. So keep pressing until when the emergency medical services come in. If there are other victims that are also going through the same thing, you can get something, some kind of cloth, and tie whatever you've stuffed on this wound. Tie it as tight as possible so that you can keep that pressure on there, and then you can attend to others. If the victim is conscious and can press by themselves, then instruct them or show them how to do that so they can press as much as possible to prevent
further bleeding.
Further bleeding. If whatever you've put is full of blood, remove it, put another one if you have another one. If you don't have, squeeze it out, put it back so that you can stop that bleeding as much as possible. Exactly.
Thank you very much. For those who have just joined us, who are following us, we are discussing health issues and we are looking at the issue of bleeding when somebody has got an accident. With me is none other than Hakim Mukwanga, who is a laboratory scientist taking us through this. He has explained a number of types of bleeding, that is arterial bleeding, venous bleeding, and capillary bleeding. These are the 3, and what should you, how should you react when you see such a situation? Now, doctor, you've talked about when somebody has been cut and is bleeding, but there is a situation whereby an object has been has pierced somebody and is in the body of somebody. What should I do?
I'll just answer that quick and simple. Don't tamper with the object. If there's an object embedded, for example, someone has been stabbed, or during the accident, a piece of metal has pierced through their leg, don't tamper with that particular piece of metal. Why? Because it is probably the one that is keeping the bleeding from happening. So if there is any blood that is coming out, just keep pressure around that piece of fabric that is inside the person, and just preventing that bleeding that is coming out. If there is no bleeding, wrap it up and keep it as safe as possible for the emergency medical services and you can explain to them that, you know, this particular area, there is this particular thing that is there. Never pull out anything. What I should tell our dear viewers is that, you know, our skin is the first line, is the primary immune system that we have. When you go into medical school, they'll tell you that the skin is the first line defense that the body has. If your skin is not tampered with, you don't have any cuts on your hands, you don't have any ulcerations, you're safe to handle that particular body part that is having that blood that is coming out. Of course, in rare cases where probably, if for example here in Uganda we can have, we've had some outbreaks of hemorrhagic fevers like Ebola, Marburg. So in such cases, of course, I wouldn't advise you to handle such situations with your bare hands, unless if you're sure of the person that you're handling. But if at all there is no any outbreaks of hemorrhagic fevers, people can be scared of HIV, of hepatitis B, of, you know, those bloodborne infections. I assure you, dear viewers, that our skin is the first line defense. So if you're not having any ulcerations or cuts on your skin, go ahead and save that life. If you're having any problems with handling that blood, maybe if your victim is conscious, you can instruct them on how they can carry out that particular procedure that you want to carry out, probably by keeping pressure on the wound by themselves if they are conscious, or tying a tourniquet by themselves if they are conscious. Then also, if you have personal protective equipment, that is gloves, mainly gloves, you can go ahead and use them, because that will be the safest way of handling it. But most of us, or most of our population, may not be moving around with gloves in maybe their pockets or their purses. So you can handle this with your bare hands. And I can assure you, after this, you can wash your hands using soap, clean them very well. If you're so scared, or sometimes if the blood goes into, you know, the soft tissues, for example, the eyes or the mouth or the nose, then there's what we call pre-exposure prophylaxis. These are medications that are given out, and I'm sure if you've been attending to an emergency like that and you're a bystander, if you give such an explanation to the government facility, they'll give you these medications for free, and you can take them. You normally take them for a full month, and they help you to prevent the bloodborne infections like HIV before you get it. That is in a space of 72 hours. Okay. So you can take these pre-exposure prophylaxis medications to also get away with that.
Okay, thank you very much. But there are situations whereby the injury, the bleeding is from either the head, whereby we cannot necessarily tie something, or the abdomen, the stomach. What should we do to such a case?
So with such a case, for example, for instance, if the injury is on the head. Now, injuries on the head are very technical, and you need to have technical know-how on how to handle them. So what I will tell our dear viewers is that if you're a first aider or a bystander, you're going to give emergency first aid, I would ask you to refrain from, number one, invasive injuries on the head. How do you know it's invasive? You know, you can tell a superficial injury from an invasive injury. So if it's an invasive injury, you see probably it is a little bit deep. Don't tamper with it, especially when it's on the head, because it's a little bit a very sensitive part of the body. And if it's just you know, a small ulceration or scratch, you can instruct the patient to apply probably gauze or a piece of cloth, so that they can keep that pressure on that particular part of the head that is bleeding, okay, so that they can prevent further loss of the blood. But if it's invasive, don't tamper with it. Wait for the emergency medical services. We are looking at things that can save life, but those things that can save life, we don't want to complicate more, because first aid is mainly to prevent further complications. So if you see that you're not well conversant in a particular procedure, it's better to leave it and wait for the emergency medical services. But sometimes you can someone may be torn and the intestines are also out. Where you're tearing, we shall show our dear viewers where the main arteries pass. So in that diagram, you can see where the main arteries pass. So if the area that is torn is not having any main arteries that are passing by, it's better to leave it.
Okay.
For example, if the intestines are out, you don't want to start stuffing them back because it's not your expertise. You don't have that expertise. So leave it and wait for the emergency medical services to come in. But in any case, if you're seeing any bleeding, just keep some pressure on that particular bleeding. If you feel like the intestines are really out and you have something that can, like a gauze that can be used to tie around to prevent them from falling out exactly, you can tie the gauze around, not so tight, so that you don't.
Some people might have a feeling that, oh, let me take them back.
No, don't take them back because you don't know actually where you're going to put them. So just tie around them and wait for the emergency services.
Maybe in just as we conclude in summary, you can summarize other things that you think, the do's and don'ts, which you think that somebody should do when somebody is bleeding.
So what I would want to tell our dear viewers on the do's and don'ts, when you find a situation, you're the first responder, you're going to give emergency first aid. Number one, make sure you scan out for those who are affected. Check for breathing, check for pulse to see if they are still alive. If so, go ahead and check and scan for any bleeding because it's the primary thing that you want to look out. You don't want someone to lose a lot of blood. So check out for any bleedings on any victims that are there. After checking them out, if you see any bleeding, number one, apply pressure to that particular bleeding site. Make sure to look out for the source of the bleeding. Number two, apply a tourniquet if you don't have quite enough things to stuff the wound with. If you apply the tourniquet, make sure it is as tight as possible and make sure to tell your victim if they are conscious that it's going to be a little bit painful. Some victims go into shock. How do you see, number one, that there is shock? Number one, the person becomes a little bit pale. Number two, they are so weak and sometimes they even faint or convulse or something like that. So if you see these signs, make the person to lie down and raise their legs above their heart. Use anything, maybe a block or a chair or a table or just blocks that you've just collected or a bag or something so that their legs are raised. This will help in blood moving a little bit more to the head so that the brain can stay active. And then if you don't know anything, please don't handle. Wait for the emergency medical services. If you see anything that has been embedded in the person, don't pull it out because it is preventing further bleeding. Probably it has punctured through a vein or an artery and it is preventing that bleeding from coming out. So leave it embedded, just apply pressure besides it, just around it, and wait for the emergency medical services. I think these are some of the do's and don'ts that you're supposed to follow until when the emergency services come in. Also, when you apply a tourniquet, make sure that when the emergency medical services come in, you tell them when you applied this tourniquet because they will need to know to prevent amputation of that leg. If they leave it for so long, then the leg will become, or the limb will become non-function after that.
Thank you very much.
Thank you so much.
That has been Dr. Hakim Mukwanga, who is a laboratory scientist, taking us through, giving us an insight into the issue of bleeding and the first aid. Again, say that whatever you have had is not the final say. Please, it was just first aid. Beyond that, leave everything to the emergency services. We meet again in another episode of Healthy Focus on Thai Press. Please keep watching, subscribe, share, like, comment. We need to hear your feedback. And if you have any question, please, you can type it down in the comment box. We shall be answering you. Thank you very much. I remain as Nahoho Rashid Matselele, your host. We meet again